name is Christina Kraft. I am an integrative medicine trained dentist, and today I want to talk to you about the concept of resiliency. It's been coming up a lot in the training that I'm doing around lifestyle medicine and health coaching, and it's a really big, complex subject when it pertains to the whole body, mind, and body health. If you define it from a non-medical human perspective, it is the capability of a strained body to recover its size and shape after deformation, especially caused by compressive stress. So in that concept, it's like if you imagine a pair of yoga pants that you have just sitting on a counter on a shelf. They are at their kind of balance point. They are at homeostasis from a biological perspective, if you apply that to it. And they are just sitting there in balance. But if you stretch them, then you are deforming them. And their ability to, once you let go of that, come back to their original state is a form of resiliency. Now, if you apply that to human beings, most of the important psychological literature on resiliency defines it as the ability to bounce back and adapt in response to adversity and stress in a timely way such that physiological resources are conserved. So essentially that means, you're going along, everything's fine, you are at your balance point, something happens, negative or positive, and you go off of your normal balance set point, and how quickly can you bounce back and come back to that point? If it's a good thing that happened, then hopefully you're slow at it, and if it is a not so good thing that happened, then hopefully you can get quickly back to your balance or homeostasis point. Let's define homeostasis really quick. That is a state of equilibrium, as in an organism or cell, maintained by self-regulating processes. So that self-regulating processes point is really important. Homeostasis doesn't occur because you have someone come and give you balance or something holds you up. It occurs because your own self processes bring you back to center. Let's bring you back to your center, your happy place, your flow. Now, let's think about that concept in relation to oral health, because having homeostasis in your mouth means something different than having homeostasis in your brain, and similar to the rest of your body. However, we know that if one part of that equation, mind-body, is out of whack or out of alignment, then you're going to have trouble with homeostasis and resiliency and all of the rest of your life too, including your oral health. Why is resiliency important in oral health in your environment? So our teeth are constantly under attack. They're constantly being exposed to adversity. Every single time we eat, we put food in our mouth, our body and our mouth has to go through the process of beginning to break that food down. That process kicks your body off of your homeostasis and your oral cavity, your mouth, off of homeostasis. And the key to having a healthy oral environment, less cavities and gum disease, is how quickly and how effectively your body can get back to your homeostasis. Secondarily, if you have a set point in your mouth that your homeostasis is not the greatest one to begin with, it's going to take you longer to get back to your not great point to begin with, and you're going to have more problems. What do I mean by not having a great point to begin with? So I just took a sip of tea. I did not put any sugar in that tea. So my mouth has to go through the process of dealing with the heat of that tea, and it has to deal with the process of whatever chemicals are in it as it washes over my teeth. It's green tea, so it'll be a bit staining, but there's no sugar, so my pH level in my mouth, the acid-base balance, isn't going to be affected very much. Now, if I was drinking if I put lemon juice in this tea, that would have sugar and acid in it, and that would actually be a pretty tough challenge, pretty tough adversary for my mouth to deal with, because once you put acid in your mouth, and even when you just eat something with sugar in it, the bacteria in your mouth cause acid to happen, which demineralizes your teeth. anytime that your mouth is in that acidic environment, you are out of your balanced homeostasis, balanced pH in your mouth, and demineralization of your teeth can occur. If you have enough demineralization of your teeth, that's where cavities happen. And demineralization is where the acid in your mouth literally dissolves the minerals out of your teeth, out of your enamel. And that's how cavities happen, repeated over and over and over again, of constantly eating and drinking food will cause that demineralization until the tooth has no more minerals in it, and the bacteria move into the space where the minerals were, and cavities form. And then the bacteria keep dissolving deeper and deeper until you have a toothache, and that's not very good. So one perspective of creating homeostasis and balance in your mouth is from the pH balance perspective. The healthier the bacteria populations are in your mouth, the more quickly and the less times a day that you put something that has any kind of sugar or acid in your mouth, the less times a day you are in that lower pH cycle, and the less cavities you can get, because you can only get cavities while your teeth are being demineralized. So I also talked a little bit about your set point of your oral health, and that has to do a lot with your salivary flow. It has to do a lot with which you have some control over, hydration levels and whatnot. It has to do with what you eat. It also has a lot to do with the bacteria populations in your mouth. So there's there's lots of different species of bacteria in your mouth, but there's two main groups. That one of them likes to eat more of the sugar that we eat right along with us and cause more acid. Those ones cause more cavities. Then there's another type of bacteria that actually cause more periodontal disease and gingivitis. And those type of bacteria live deep down in the pockets of between where our teeth and our gums meet. And those bacteria are more inflammatory causing. So the goal is to create a healthy population balance between healthy bacteria in our mouth that helps begin breaking down our food and bacteria that cause cavities and bacteria that cause gum disease. If you have an overpopulation of either one, you'll be more prone to have those things. And sometimes it's genetic. Your genetic set point is part of that. What your body fights off and what it doesn't, and what type of bacteria your parents gave you when they kissed you as a baby that started you off with the bacteria in your mouth. So creating a healthier balance of those bacteria in your mouth so that you have less of the bacteria causing cavities and gum disease creates a healthier set point. And having less of those means that every time you put something in your mouth that kicks you off of your homeostasis, your defined set point, it's easier for your body to self-regulate and create or get more quickly bounce back to that healthy state where bacteria aren't causing gum disease and they're not causing cavities. So essentially, by altering the bacteria species load in your mouth so that you have a healthier balance of species and populations, you're creating more resilience because your body can bounce back faster than if you have complete out of control bacteria populations in your mouth. And there are lots of ways to do that. I can talk about that more in another video, but I really want to focus today on what that concept is. There's another concept I want to talk about that has to do with the tissues in our mouth that we have. So the tissues being not just the teeth, but the gums, the tongue, the cheeks, and those tissues are essentially designed to take a beating. They are a very strong self-regulating tissue in our mouth. So for example, with this tea, it's delicious. I can stick my finger in it and it's really hot. I pull my finger out really quick. However, if I take a sip, it doesn't seem that hot to me. And that's because our body's nerve receptors and the tissue in our actual mouth, tissue being the gums and cheek and tongue, are either designed or evolved, depending on your perspective on that one, to be able to handle hot, cold, sharp foods. You're essentially chewing and masticating with not just your teeth, but your soft tissue. So those are constantly sloughing and regrowing all the time. So your body's really good naturally at creating bounce back of your tissues in your mouth and resiliency of your tissues because it's constantly remaking them. Now, if you have something going on in your life, some other disease process, chronic stress being a big one, that causes delayed wound healing, all of your body's tissues are not responding and healing as well, including the normal reactions that happen in your mouth with you eating and drinking. That's why a lot of times when I have patients that are going through chemotherapy or have some kind of cancer, they get mouth sores, they get all of these problems in their mouth with all the soft tissues because their body is not healing. So having resiliency, not just in your bacteria species, in the way that you're eating and drinking food, but also in your whole body, allows you to have a healthier mouth. And having a healthier mouth makes everything else healthier. It's a two-way street. It's amazing how all of our body systems work together. So that's what I want to talk about to you today. I recently read a chapter in one of Brene Brown's book, Atlas of the Heart, and she was talking about curiosity, and she made a really important statement that made me want to do these videos. It was you can only be curious about something you know a little bit about first. So you don't know what you don't know, and if you don't know anything about it, you can't be curious about it because it doesn't even exist to your mind. So I'm going to do my darndest to give you guys things to be curious about, and hopefully you can enjoy learning about them with me. Thank you.